Good morning. I'm pleased to be here with you this morning, and I thank the panel for raising leadership as a really important overarching consideration in cross-sector work. I believe it is the secret sauce of cross-sector work, and I believe it can make or break collaborative efforts. I'm framing my presentation today based on the work of the Health Education Council over the past 25 years, working with non-traditional partners in a variety of health initiatives, including obesity prevention. And I also sought the input from key stakeholders who I believe really exemplify leadership related to obesity in the Sacramento region. Throughout, I'm going to mention our work with the South Sacramento Healthy Eating Active Living Zone, or HEAL Zone initiative, which is a Kaiser Permanente supported initiative, and I think our next speaker will be talking more about that. So I looked at the overarching consideration of leadership and the questions, and I'm going to be talking about lessons learned over the last 20 years, what it means for leadership and the importance of leadership in cross-sector work, and what that means launching forward. When talking about lessons learned, I want to talk very practically about the 3 T's: terminology, time and timing, and trust. So to start with terminology, we've heard from our prior speakers this morning that there are a whole lot of sectors of work that's going on throughout the country related to obesity and healthy eating, active living. This is a list of some of the partners that we are working with locally in the Sacramento region. What I want to say about terminology is that each of these sectors has its own set of terminology, its own language, its own words, its own jargon, and it could be really difficult to gain common understanding when there's so much lingo in everybody's sector. Terminology matters, and one of the, I just call out 2 simple words here. We're working on a collaborative that's looking at the health-wealth intersection. And we have spent, this is a collaborative that's been meeting for a year and a half. We've spent the last 4 2-hour meetings trying to get a common understanding of the word asset. For those of us in public health, we talk about community assets and asset mapping. Those in the financial field talk about asset building and asset poverty. The word safety, given the broad array of partners, has different meaning depending on where you come from. Safety for many of our partners means violence prevention or gang intervention. Our business partners see it as property crime or loitering or crime against business. Our built environment partners see it as safe parks and public places. Schools see it as safe routes to school. Additionally, each sector is full of acronyms, which I like to call alphabet soup. So if we look in this bowl, this is just over the last month, all the acronyms that I've come across, most of which I don't understand, many of which I'll ask the sector person what they mean, and they'll have to think for a minute about what exactly this particular acronym means. I learned that I was really presumptuous in thinking that everybody knew what HEAL meant and what a HEAL zone was. So there was a blog in the New York Times where the author implored us to ban the promiscuous use of acronyms. They detract from common understanding. So in terms of terminology, I think we need to invest in understanding the terminology and language of other sectors, what they mean, and recognize that they may not be the same. We need to stay away from jargon and acronyms. Second T in my lesson learned is time and timing. Cross-sector collaboration takes an intentional investment of time to get to know the language of other sectors and how they view the problem, for the reasons for being involved. It takes time to see the different ways to connect the dots. It takes time to see the world from somebody else's lenses. It takes time to develop relationships, understanding, educating ourselves to think in different ways. It takes time to see relevant intersections that may not be obvious when we start. Our South Sacramento Healthy Eating Active Living Zone Collaborative started over 3 years ago. And what we saw was many community assets and many entities doing the work in the zone. But they weren't convening together to spend time to develop synergy and to leverage all the great work going on in the zone. And so over the last 3 years, we meet monthly. We have updates. We try to deepen our understanding of what raising the health of the community means with each of the individual partners. It took time for us to see how we could operationalize the understanding that obesity requires many partners working together. The second part of time is timing. And what I've learned over the years is that sometimes the timing for cross-sector partnership is just not right. There are some organizations, entities, and individuals who just are not good sandbox players, who are stuck staying in their own silo, who may talk about silo busting, but really are not committed to it. This is influenced by readiness, a lack of leadership at the organizational level or at the individual program director or staff level. And the second thing about timing is sometimes opportunities arise which present and can gel collaboration. Summer Night Lights in the South Sacramento Hill Zone was one such opportunity. One of our Hill Zone goals is to increase physical activity in community settings. But this is impacted by all the things that Mildred was talking about in many of our communities. Our zone has one of the highest crime rates in the city, highest violence rates, and all of this peaks during the summer months. During a walk audit that our volunteers were conducting, there was a shooting 10 feet in front of our team. There's high gang activity and high business and property crime, loitering, and very high emergency room visits for violence-related trauma in the zone. Several members learned more about the Los Angeles Summer Night Lights program and felt that we had the collaborators to try it in our zone. This is the listing of some of the partners of our collaborative that's set forth and the reasons for wanting to be a part of Summer Night Lights, all of which you can see are very different. One of the partners that's not listed up here is the schools, for example, really wanted to be a partner because they have a summer food program and wanted to expand their reach to the community. These sectors converged to launch Summer Night Lights this past summer. It was a true collaborative effort between many of our sector partners. Over the summer, there were 42 nights of activities from May to August, every Thursday through Saturday, of healthy summer meals, fun, games, entertainment, basketball, and other activities for residents, youth, and our partners. We are still collecting results, but the results initially have been dramatic. We've dramatically reduced calls to police and business security, loitering and property crime has been reduced. There's been dramatic reduce of arrests, reduced emergency room visits for violence-related trauma, and most importantly, not a single homicide in the zone over the summer. Our partners at the Sacramento Police Department told me Friday that they can't remember the last time in the Hill Zone that there wasn't a homicide. They've gone back in their records 5 years and they're still looking. There was also a lot of education that was happening around healthy food and beverages. One of the youth that was coming to the events asked for more of those red round things to eat because he really liked those. And we all scratched our head and said, "Oh, I think you're talking about grapes." we took this opportunity to provide, this collaboration provided not only a healthy, safe environment for the community to come together, but time for education as well. So in summary, time is one of the critical factors in cross-sector collaboration, and timing to be open to opportunities. Finally, trust. 25 years ago, when I wanted to start working with the African American Church, I approached Bishop Sherwood Carthen, and he told me that if I wanted to work with the faith community, that I had to build trust, history, and relationship. And we do that first by building relationships. Building relationships builds a history of doing things together, which builds trust. For over 20 years, we worked together to link the church with a variety of health initiatives. Every person I spoke to when I asked them about the key leadership ingredients to successful cross-sector collaboration said trust. Trust is time-driven. It doesn't happen overnight. Lieutenant Roman Murrieta told me of the Sacramento Police Department. Summer night lights, he said, help to build relationships with the community and develop trust. He likes to call community policing relationship policing. I'm looking for my... You all can get jiggy too. So here's, you see Lieutenant Roman up here dancing with the group. Lieutenant Roman is one of those leaders that truly embraces and understands the value of relationship building. On the last night, the 42nd night of Summer Night Lights, we did an evaluation with participants, and many of the comments from residents noted things like, I liked seeing the police in our neighborhood having fun. Understanding how you enter and exit a community or sector is really important. Entering with humility, knowing that your agenda may not be their agenda, entering into collaboration, knowing that how others view an issue may be different from yours. Your terminology may be different, but the end goal will be the same. Let's see. Thank you. That was my secret helper in the back that helped me do that. Finally, secondly, I want to talk just about leadership. So what is the role of leadership in cross-sector collaboration? Oops. Collective Impact says that leaders of successful collective impact initiatives have embraced a new way of seeing, learning, and doing that marries emergent solutions with intentional outcomes. This new way, to me, involves a commitment to spending time to learn terminology, build trust and relationships, so that solutions that are not always evident at the beginning can emerge and become more evident through the process. Other models, integrative and collaborative leadership, notes that leadership work is central to the creation, maintenance, and success of cross-sector collaborations to advance common good. So I've tried to just summarize, I think, what I've learned from seeing and talking to leaders who I think exemplify strong leadership skills in cross-sector collaboration. I'll note that many of these are more value-oriented. They're attitudes rather than hard skills. But in my mind, a strong leadership in cross-sector collaboration is a strong relationship builder, someone who deeply values collaboration, respects others' expertise, strongly believes that separate efforts to address obesity or health have not worked and cannot solve the problem. A leader that recognizes that champions come in many levels and provide formal organizational leadership and informal leadership. We repeatedly heard from folks, those best leaders are the ones who let go of their ego and they believe in shared leadership and ownership. They build understanding why everyone needs to be at the table. They gain trust of the collective group and of individual partners. Results-oriented, a leader who understands the process of collaboration and sets milestones to achieve and understands there's a sweet spot between learning and listening and doing something action-oriented. Focused but flexible, a leader that ensures the structure of collaborations is flexible and adaptive enough to deal with shifts, but stays focused to move strategically forward. Understands that the types of leadership that is needed in cross-sector work may change over time and is constantly asking who else needs to be around the table. A leader who keeps their eye on the prize, and that prize for us is always community and resident needs, as opposed to organizational needs and objectives. Finally, influential communicator recognizes that conflict is very common in partnerships and uses resource relationships and strategies to equalize power and solution seeking. A leader that believes everybody has an important voice and that trust building activities are continuous and an investment. The reality is there's a lot of self-interest, there's a lot of competition, there's protection of interest, there's money and recognition and competing barriers that get in the way of cross-sector collaboration. So what does all this mean for moving forward? I agree that the timing is now to find new solutions. One thing that I do want to say is that we cannot forget resident leadership. The leadership of organizations is critical, but so is resident leadership, as they have the power to change neighborhoods in ways that organizations may not be able to. We hear much talk lately about changing the narrative to affect policy systems and environmental change. We believe that changing the narrative must include strong resident-led and driven advocacy and creating a new community narrative. Our Summer Nights Lights evaluation had several comments from residents who are beginning to change the community narrative, who said, "It's so nice to not hear all the bad things happening in our community." This was very positive for our neighborhood. This is Phyllis Lucent. She is a resident leader. She has 10 siblings, 8 diagnosed with diabetes. She became a resident leader, leads walking groups, hands out fresh produce, and advocates for her change. I believe it's imperative that we continue to involve residents. I recognize that collaboration is not always linear. It's often unclear and messy, but it will lead to some good solutions. Thank you.